to facilitate clinical complexity of a patient population and account for differences, for example, in severity of illness and risk of mortality. And pay-for-performance is a very hot issue right now. A lot of physician conferences have been purporting that. So patient classification systems in our EHR are based on a template-based question and question group, which I will show later in the application flow. These questions and question groups basically categorize clinical origins, and they will be appreciated by physicians because they will reward the physicians for the clinical complexity of their work, which will ultimately lead to a proper evaluation and management coding. Such quality management is facilitated in our system through multiple means, such as reporting, flow sheets, comparison tables, health maintenance and disease management protocols, and integrated educational materials, all of which are facilitated according to the requirements and workflow of a setting. These are some of the benefits, and eventually towards the end of the presentation, these will also be emailed to all of you so you can browse through them comfortably at your own pace. But some of the benefits that a comprehensive health records management would allow you, a complete clinical record information inclusive of patient problem list, patient history, physical exam, most recent vital signs, also access to patient information in very specialty and template-specific forms. It organizes and prioritizes patient-related communication messages, whether they're messages related to patient or lab results, and it supports all of those management and communication until resolution. In SequelMed EHR, it also provides sectional views of progress notes and visit and referral notes, ultimately leading to reduced operating costs and workflow optimization and quality of patient care, which will avoid redundancy in all areas. There's a lot of redundancy right now throughout the manual process, whether it is in terms of storing documents in a physical place or a courier providing different communication through different communication channels. All of that redundancy is diminished, if not completely eliminated, at least initially, throughout this. Lab management allows you to send lab orders and receive results electronically based on automated linkage of problem lists and assessments to different lab orders. It also provides diagnostic templates for better clinical and effective results reporting, as well as HL7 and DICOM support for images that, based on your specialty, whether it's cardiology images or neurology images or immunology, any specialty images that can be integrated so you can view X-rays and MRIs and CT scans within a EHR. The pharmacy management as well as medication management allows you to facilitate ordering of medications in an organized manner and legible manner, using administrative documentation of medications based on drug formularies. For example, the instructions, times, dosage, and form and strength are available in the system, so with one click. And again, all of this expressed in our EHR shortly, as I will go through the demo. One of the many important things that medication management allows is immediate prospective adverse alerts with respect to contraindications, drug-drug reactions, drug allergy reactions, drug-food reactions. So at the time of point of care, an EHR facilitates those kinds of adverse alerts based on the drug formulary. Generation of appropriate timestamps so that you are able to see at what time which medication related to which activity to substantiate efficacy or lack thereof of different medications were ordered. And many more, including timely alerts to potential duplications of drug therapy. The fourth thing that we talked about earlier was workflow tasking and communication management, and that is facilitated also by the quick sharing and routing of data throughout the system and throughout multiple recipients of the system, which eventually leads to increased efficiency. Because it is a one integrated solution, you are now able to consolidate the clinical, the administrative, and financial management into one system. And that essentially is what is represented by electronic health record. The patient demographic data, whether it's financial data, all of that is captured in a consolidated form. Just like we talked about from a clinical point of view, it also facilitates all the profitability or any kind of tracking that we do or we are conventionally used to in a billing system or a document management system. Basic clinical, financial, and administrative reporting, all the data that you collect in an electronic health record, in order for it to be a true continuity of care record, you should be able to do